Sarah Ling, and I'm a recent graduate of Des Moines University. I graduated this spring as a doctor of osteopathic medicine, and I'll be starting my family medicine residency at Broadlawns here in Des Moines in actually just a week. So I'm excited about that and looking forward to that endeavor. And while I was at Broadlawns, I was able to do a 4-week rotation there and help with a project to improve childhood immunizations in children less than 3 years of age who are being seen at the Family Health Center at Broadlawns. So that's the project I'd like to talk to you about today. So just a little bit of background on the project as well as on immunizations. According to Healthy People 2020, for each birth cohort that's immunized using the routine immunization schedule endorsed by the CDC, 33,000 lives are saved and 14 million cases of vaccine-preventable disease are indeed prevented. So that was an important study, and Broadlawns is aware of that. And so 1 year ago, they began a system implementation to try to improve childhood immunizations in kids under 3. And Broadlawns is a patient-centered medical home, NCQA Level 3 patient-centered medical home. And so a system-based approach really made sense for that setting. And so I'll tell you a little bit about the actual system implementation. There were 4 key steps of the implementation. First of all, a quarterly audit was begun where all of the immunization records of kids under 3 were surveyed, and specific children who were deficient or missing immunizations were identified. And then secondly, a letter was sent to the caregiver telling them that their child was behind, and then specifying which immunizations they were deficient in, and then encouraging them to call Broadlawns and schedule an appointment to get caught up again. And then the third step of the implementation was to really improve pre-visit planning. So any child that was coming in for either an acute visit or a well-child visit would have their immunization records surveyed before that visit, so that during the visit the provider could talk to the caregiver or parent about the deficient immunization status. So that was the third thing. And then lastly, any child that missed their well-child visit, the caregiver was called and encouraged to reschedule that visit. So that was kind of the key implementation about a year ago, like I said. And then at midpoint, which is about 6 months later, a review was performed, again an audit, and unfortunately the immunization rates weren't improving much. Broadlawns immunization rates for kids under 3 were still below both national and Iowa state averages, which is a little disappointing. And so at that point we decided to administer a survey to all caregivers of children who were deficient in immunizations to just determine why they weren't getting in. Was it difficulty in transportation getting to Broadlawns, which is a common complaint for a lot of patients that come to Broadlawns, or was it inability to get into the clinic, or did the parent just forget, or was it an elective delay or an elective decision to not receive the immunization? So we just didn't know why people were coming in. So we designed a survey, telephone-based survey, and called all parents that we were able to. And then in addition, at that midpoint review, we really noticed that the 15-month well-child visit was a point in time where the immunizations just dropped off for all immunizations. We saw this drop off. So at that point, we began calling parents or caregivers prior to the 15-month well-child visit to say, hey, don't forget about that appointment, come on in. So that was also initiated at that point. So the results of the qualitative survey were very beneficial. It did end up that the number one reason that parents or caregivers weren't coming in was because they didn't feel that they had access to provider visits. So they'd call in and there wasn't availability for the time slot they needed, or they'd have difficulty getting off from work, and so they were just unable to schedule when they wanted to. So Broadlawns quickly accommodated that and opened up more space for well-child visits, and then also encouraged patients or caregivers to bring their children in just for a simple nurse visit to receive an immunization that they might need. So then the system implementation continued, that being the 4 steps that I talked about previously. So that was continued. The 15-month well-child visit, pre-visit phone call was continued to remind caregivers to bring their kid in. And then with those continued efforts, 1 year later, the results were really remarkable, and we're very thrilled to report that Broadlawns vaccination rates are above both national and state levels. So that is apparent on the graph. I'm not sure if you can see it or if you're able to, but on the x-axis you can see all of the variety of immunizations that children should have received by the time they're 3, or between 19 months and 3 years old. And then on the y-axis you can see the percent of children immunized. And so it was a very, in our eyes, a successful intervention, very clinically relevant. We're happy with the results. We're going to continue with the audit, the quarterly audits, and continue with those regular reminders and patient letters. So we're thrilled with the results, and so hopefully if anyone else is having difficulty getting their immunization rates up for kids, that this intervention might be helpful. So